Hey, I'm Lieutenant Kevin Petrus with the Charlotte-Mecklenburg Police Department. We're here today at the Police Training Academy. This is a location where police recruits come to receive basic law enforcement training when they're in the academy here, and also where officers come to receive additional training as part of their in-service training. Today, I'm joined by Lieutenant Poplin and Sergeant Leggett, as we're going to be discussing how CMPD officers are trained to deal with subjects in medical distress. Each of these gentlemen have expertise in different subject matters. Lieutenant Poplin is a subject matter expert here at CMPD for how we administer medical care to people in medical distress. And Sergeant Leggett is a subject matter expert in subject control and arrest technique. I just want them to go ahead and introduce themselves really quick.
As he said, my name is John Poplin. I am a lieutenant with CMPD. I'm also a paramedic. I'm one of our specialized instructors. I teach first responder, CPR, TAC med, and other medical topics.
My name is Ryan Leggett. I am a sergeant in the Special Operations Division, and I also serve as a subject matter expert and instructor for subject control and arrest techniques.
All right, very good. Thanks, gentlemen. Let's get into this. All right, Lieutenant Poplin, as we begin the discussion on how CMPD officers are trained to deal with subjects who need medical care or are in distress, can you start us off by telling us what training CMPD officers receive?
Right, so all North Carolina police officers and deputies get 32 hours of first responder training during the basic law enforcement training program. On top of that, our officers every 2 years recertify as CPR, and we have about 50% of the department that have been through a TAC med program that includes bleeding control and Narcan training. All of the training that we get is very basic, just by default. We're not certified as EMTs or medical responders. It's just more of a how to fix somebody that's bleeding really bad and how to recognize medical issues to realize that it's beyond your scope of care, so you can request fire and EMS and they can come get them to the hospital.
Okay, very good. When we think about CMPD officers encountering a situation where someone might be in medical distress, what are the main factors for an officer to consider going into that?
Initially, you got to make sure the scene is safe. We are, of course, the first ones to these scenes. Fire and EMS won't come into a scene until we determine that it's secure, and that may be that we have to arrest the suspect or that we have to make sure that our victim's not covered up in gasoline or something that would produce a threat for any other responders. Once we've done that, we've requested EMS, we will take steps to use any of our training that we have to take life-saving measures. So if they're not breathing, if they're bleeding heavily, we've got training and some very minor adjuncts that we can use. We have tourniquets to try to treat these things. But the vast majority of medical conditions, there's nothing that we can do anything for them. So we have to make sure that we request EMS, get them the help they need as fast as we can, and take the small steps such as protecting the airway so that they are continuing to breathe, and observing them so that if they stop breathing, we can start doing CPR.
So as an officer is dealing with a situation like this, and there's a person who needs this medical assistance, you talked about making sure the person's airway is open or maintaining the airway. How can we do that?
With that initial observation that there's a problem that is beyond our capabilities of taking care of, and we've requested EMS, for instance, a stroke or someone that just had a seizure, there's just not a lot that anybody can do. For the police officers that are there, they're going to be expected to watch the person, to observe their status, to see if their breathing is good, if it's not good, to give them rescue breaths or to administer CPR. One of the techniques that we can use when somebody is is unresponsive and is not able to protect their own way is called the recovery position. And that's where you lay them on their side and you prop them up so that if they have any vomitus, any secretions, any blood, that they don't aspirate on that and that they're able to breathe on their own.
Okay, can we demonstrate that? Can you demonstrate that for us?
Absolutely. So this is a demonstration of the recovery position. There's a couple of different ways to do it. This is a traditional method. You see that we're on our side. He's using his leg and his arm to keep himself up. His face is pointed down towards the ground so that if he does have anything in his mouth, it'll come out. He won't breathe it into his lungs. It's important to see this in this capacity because he's unresponsive. He's not able to hold himself up right now. So quick example, I'm going to have my demonstrator put your legs straight and your arms straight and just try to balance on your side. So if I was just to leave an unresponsive person like this and walk away, what do you think is going to happen? He's going to roll over one way or the other. Neither of those positions is ideal. We want that recovery position. So if we have an unresponsive person, we're going to use his leg and his arm as kickstands to keep him from rolling over. If they're responsive, but we have them restrained, because occasionally we'll have somebody that we have in handcuffs that we need to make sure we protect their airway. Let's say we're waiting for EMS to get there. You're going to have some extra help to keep them in that position so they're not rolling over. So you'll see officers holding them and talking to them, because part of our training is to communicate with the person, try to make sure they understand, hey, help's on the way. And in doing that, you also can observe their mental status. They're hopefully talking back to you, and you'll be able to, with that, know if their airway is okay and open.
Can we demonstrate if he's in handcuffs and he's in our custody? What does that look like?
So this would be if he was in handcuffs in our custody and for some reason he was unable to either keep himself upright and protect his own airway, or if he was not cooperating and we were having to hold on to him so he didn't hurt himself or anybody else. Again, we're waiting for EMS to get there because we have recognized there is a problem that's outside of our scope of care that we can't take care of. We don't have the equipment or the training, so we're waiting for EMS to get there. Our goal, to keep him safe from hurting himself or anybody else and keeping his airway open. The example we have right here, we have a responsive and cooperative subject. We've got him in a position where he can maintain his own airway. A lot of times this is perfect. This is great. Matter of fact, this is what we prefer. If we can sit with somebody, hey, we got EMS coming, they're going to check you out, just hang tight for a few minutes. So we're able to have that conversation with them. We can assess their level of consciousness, their breathing, etc. The reason that if they are unresponsive, we can't keep them in this position, or if they're not cooperative, where they're kicking or flailing, is we have to be able to protect their airway. So pretend like you're unresponsive. Just lean forward. So if I'm presented with this victim and I'm trying to maintain his airway, I can try to manually open it. I can pull him back. I can lift up his head. And we're taught about how to do a modified jaw thrust or a head tilt chin lift. However, with those techniques, sitting upright, we can't guarantee, without airway adjuncts, which we don't use and we aren't trained on, you can't guarantee that you can keep the tongue and the tissue from collapsing in the back of the throat. So in this position, if he was unresponsive, we can't guarantee we can protect that airway. And that's the most important thing that we're doing. So that's why if you have a cooperative patient, yes, this is great. If you've got somebody that's alert and can protect their airway, this is how we would usually have them sitting. It's more comfortable to them, not struggling around. If they're unresponsive, if they're uncooperative, in order to protect that airway, we're going to lay them on their side. And if they're in handcuffs, you're going to have 2 or 3 people to keep them from rolling over.
Okay, Sergeant Leggett, we have in this scenario here a person who is in handcuffs. His hands are behind him in handcuffs. He's in our custody, and he's on his side in this recovery position that Lieutenant Poplin talked about. Can you explain what's going on here now with the officers and what they're doing?
Sure, absolutely. Our primary focus when we're taking someone into custody, and also when that person is in our custody, is the safety of the officers present and also the safety of the subject. And you'll see this look a lot of different ways. There's a lot of variables that come into play. The size, skills, ability levels of the officers on scene, the size, the skills, the ability levels of the subject on scene, and also that individual's level of cooperativeness, how much that individual is willing to work with us and follow commands. You see here a subject who is not resisting, he's responsive. You have an officer here on the legs, controlling the legs and also helping support the individual. If this individual decides to thrash, kick, try to get back to his feet, an officer on his legs can prohibit that from happening and make that more difficult for the subject. Here, the second officer you see supporting the subject's back. Again, no pressure on the diaphragm or anything that would interfere with the subject's ability to breathe. But again, supporting the subject has is under good solid control here, good grip on the arm. Officer's knee is firm up against the subject's back, keeping the person in place, keeping the subject in place, keeping them in that good side recovery position so that airway stays open.
Okay, very good. So would this be why we might see multiple officers around one subject that's on the ground?
Again, absolutely. And again, as we discussed before, there are a lot of variables that come into play when you're talking about subject control. This could be a really large individual. This could be small officers. It might take more officers to hold this individual on his side. Depending on how cooperative this individual is, it might require more officers. Again, our primary focus is the safety of the officers present and the safety of the subject in custody. So again, we have to adapt to that individual's level of resistance and the individual variables that come into play on that particular call.
Okay. And going back to, the possibility of standing a person up or sitting them up, like Lieutenant Poplin was talking about, is that possible when someone is uncooperative, say?
Uncooperative, no, that's not going to be advantageous for us. If the person's uncooperative, we get them to their feet. They have the ability to run away, to kick, to become more dangerous to us, and in turn become more dangerous to themselves. Again, we want to limit the risk for officers and subjects here as far as risk goes. So if the individual is not being compliant, the ideal position is on the ground in that prone position or in that recovery position.
Okay, so you mentioned the prone position, and that means face down.
Yeah,
right?
Prone, face down. And again, that's going to give us a higher level of control than this recovery position. If the person's all the way on their stomach.
Okay, so when and why might we see the prone position versus the recovery position?
Again, there are a lot of variables that come into play when we're discussing this. The prone position will give us a higher level of control. Our officers are trained to, again, control the legs, and if necessary, put weight across the shoulders, avoiding the neck, avoiding the lung area, but across the shoulders. Again, dependent on that person's level of resistance. This also might be a necessary position to accomplish post-arrest searching. That's something we have to do, and depending on again, a lot of variables, right? Depending on what the individual's wearing, the confines of the area, a search could take an extended period of time. As you see here, we have a subject with multiple pockets on his pants. So if an officer begins his search here, you'll notice this can take a certain amount of time. But again, it's very very dependent on the situations present. Ideally, we would like this person in the recovery position on his side, but again, that's going to be very very dependent on the other variables that are in play.
So, Sergeant Leggett, while we wrap this video up, it sounds like what you've laid out is a template or a blueprint for how we train, but that's not necessarily going to be the case for every single situation. Am I understanding that right?
Absolutely. We, again, as I mentioned before, our primary focus is the safety of the officers present as well as the safety of the subject. We have a general guideline of techniques we're going to use and things we're going to try to accomplish when taking a subject into custody. Ideally, the subject's cooperative and we have to use no level of force, or there's no level of resistance we have to respond to. But depending on that level of resistance is how our officers are trained to appropriately respond, which is why you see prone handcuffing, which is a state-taught and official technique that we're trained to do, because sometimes that is the safest way to take someone into custody. That person being in that prone position, depending on the necessity of the search, the complexity of the search, the level of resistance that individual's offering, again, that could be the safest position for everyone there. And again, as that level of resistance goes down, that's when you can see officers start getting the subject to the recovery position on his side. And as that level of resistance goes down and the level of cooperativeness goes up, we can get them maybe on their butt or standing. So again, it's very dependent on the level of resistance we're getting from the subject present, as well as the skills and abilities of the officers present.
Right, and it sounds like, based on the discussion today, the level of consciousness of the person that we're dealing with, or whether they're lethargic or able to support themselves or not, all that plays into it. all that plays into it also, right?
Yeah, absolutely. And again, safety of the officers and the subject.
Right.
Sometimes the violence the subject is exhibiting is against themselves or inanimate objects. They're thrashing their head in the ground or into something else, a wall that might be near them, a car that might be near them. Who knows? Again, a lot of variables come into play in these situations. And again, sometimes that prone or that recovery position, depending on the situation, is the safest position for that subject. But again, that has to be a judgment call made on the scene by the officers, taking all those variables into account and making that split-second decision of best practice for, again, keeping themselves safe as well as that individual being placed into custody safe.
All right, very good. I want to thank you for watching. I want to thank Sergeant Leggett and Lieutenant Poplin for helping us walk through this today. Hope it was beneficial. Hope you're able to learn a little bit about how CMPD trains our officers to deal with situations like this. Thanks for watching.